This presentation will include information about acid-base balance. Acid-base balance and hydrogen ion concentration must be regulated within a narrow range for your body to function normally. And any slight changes of the amount of hydrogen or the amount of pH in your body can significantly alter all the biological processes within your cells, your tissues, and therefore your organs. Your maintenance of hydrogen ions are necessary because they maintain the integrity and the speed of all your enzymatic reactions in the body, and most of the pathological conditions disturb your acid-base balance in your body. The degree of the severity may be harmful, more harmful than the actual disease process itself. So what are we even referring to when we say acid-base? Well, acid-base balance refers to the equilibrium between how much acid, so hydrogen ions, and how much base, how high your pH is, those concentrations in the body. Your acid-base balance is regulated primarily by your lungs and your kidneys, and then we have help to compensate some of these reactions on the various buffer systems. Acids are formed as an end product of protein, carb, and fat metabolism, and we are able to maintain a normal pH by neutralizing hydrogen ions or excreting them. In terms of pH, we are measuring the acidity or the alkalinity of a solution, so how acidic or basic that solution is, and it's usually expressed from the number or scale number 0 to 14. And the pH of 7 is right in the middle. That is considered a neutral pH. Anything below 7 becomes more acidic, and anything above 7 is considered alkaline, or we use the term basic. Our body's pH needs to be tightly regulated around 7.4, so we are slightly alkaline. So again, any deviation can lead to health problems, and we maintain our balance through three major mechanisms: the respiratory, the metabolic, so through the kidneys, and then the buffer systems. So let's start with the buffer systems first. These buffer systems help us by quickly binding or releasing hydrogen ions so that we can help our body to stabilize the pH. So our body recognizes when the acidity is too high or too low. We also have temporary reservoirs for hydrogen ions, and this helps to prevent any drastic changes in the pH when acids or bases are being added. And that primary buffer system in the body includes the bicarbonate buffer system, the phosphate buffer system, and the protein buffer system. So in conjunction with the respiratory and renal system, or the respiratory metabolic systems, these buffer systems help to maintain this acid-base balance. The respiratory system is crucial. It plays a critical role in maintaining our acid-base balance by helping us to eliminate the CO2 or carbon dioxide, which is an acidic waste product. So as we breathe in oxygen and we release CO2, we're helping actually to maintain that acid-base balance through the respiratory system. When we have CO2 and water in the blood, this forms carbonic acid. The respiratory system helps to disassociate that hydrogen ion and the bicarbonate ions. It adjusts the rate and the depth of breathing and able to do this. Our lungs control the elimination of CO2, and it regulates the level of bicarbonate and hydrogen ions in the blood. Or our kidneys also do an amazing thing as well to help regulate acid-base balance. It's going to control the excretion and then the reabsorption of bicarbonate ions and hydrogen ions, and it will either eliminate any excess hydrogen ions in the urine, or it's going to help to reabsorb and generate new bicarbonate ions depending on what our body needs. And lastly, the renal regulation does take longer to adjust to pH compared to the respiratory system. So our respiratory system acts a little bit faster. It kind of realizes or recognizes that we need some balance before the renal system does. However, the renal system provides a more long-term solution to the overall acid-base problem. So when we have a disturbance in our acid-base balance, it includes or it occurs due to the imbalance in the level of our CO2 that's in our blood. When this happens, we have respiratory acidosis. And this results because, remember, CO2 is acidic. We're holding on to too much CO2. We're holding on to too much acid, therefore our body becomes acidotic. This leads to an increase in carbonic acid levels and an acidic pH. Respiratory alkalosis is caused by any excessive elimination of CO2, breathing off too much CO2, and this could lead to decreased carbonic acid levels, and also it gives us a more alkaline pH. Well, the metabolic disturbances are related to changes in bicarbonate ions and how much bicarbonate ions are in our body. We are in a state of metabolic acidosis when there's too much metabolic acids or we're losing too much bicarbonate ions, and this is going to result in a decrease in our pH. An increase in our pH would occur if we have excess bicarbonate ions or a loss of the metabolic acids. We're going to look at pH now. The normal range is 7.35 to 7.45. And our hydrogen ions, or that concentration of hydrogen ions, is commonly expressed in pH. And so when we look at pH, that's what we are trying to, we're trying to understand the quantity of hydrogen concentration in our body. And as our hydrogen ions increase, our pH will decrease. So meaning the more acidic you are, the less the number is with your pH. And the same is true if you have more hydrogen ions and less hydrogen ions. So hydrogen ions are decreasing, then the pH is going to increase, because as our acidity decreases, that means we become more alkaline or more basic. We are trying to get as close to 7.4. So anywhere between 7.35 to 7.45 is correct. And some labs will skew this a little bit, maybe 7.32 to 7.48, depending on how their machine is being calibrated. Hydrogen ions are gained in the digestive tract and through cellular metabolic activities, and this is why the end products of carbs, proteins, and fat metabolism end up being acids. But how are we going to neutralize this so that because we know that hydrogen or too much acidity can disrupt our tissues and then our cells and our organs? How do we neutralize the hydrogen ions? Well, in the state of acidosis, this hydrogen ion is going to shift into the cells and try to exchange itself for intracellular fluid potassium. So when our body is in a state of acidosis, it knows that we need to compensate. So it increases the serum hydrogen ions by shifting those hydrogen ions, or it's compensating but it's compensating because you have too much hydrogen ions in your blood. And then it's going to shift those ions back into the cell, but if it shifts hydrogen into the cell, it has to push out electrolytes. And the electrolyte that gets pushed out is potassium. So when we are acidotic, a lot of the times you'll also see hyperkalemia occurring at the same time. With the buffering systems, we know that we have chemicals that will help to bind to any excess hydrogen or any excess hydroxyl ion, which is OX negative, okay, which is a base. And it helps to do this without changing the pH significantly. It's trying to keep everything in line without causing too much of a drastic shift. And the most important plasma buffering system is the carbonic acid bicarb pair, which operates between the lungs and the kidneys. But we also have the protein buffering, which is through the hemoglobin. And this is where our proteins have negative charges that bind to the positive hydrogen ions. And then we also have the renal buffering system, which is the process of secreting any excess hydrogen ions in the urine as we reabsorbed bicarb. So we're going to look more closely at these three buffering systems. With the carbonic acid bicarbonate pair buffering system, again, both lungs and kidneys help together to create this process. The lungs are going to correct this acidity or alkaline state by either increasing or decreasing ventilation. If we have too much acid, we have to increase ventilation to expire that extra CO2, which is acidic, or we have to decrease the ventilation to help us retain carbon dioxide. In the renal system, it's going to help by providing a buffer to the excess pH by producing either an alkaline type urine, or if we are too alkaline, it becomes a little bit more acidic. And so there is a ratio involved to help us to reach that best of best pH, which is 7.4. That ratio is 20 parts bicarb to 1 part carbonic acid. And you can see here in this chart that the buffering pairs working together and the organs and the mechanisms that are included in this carbonic acid bicarb process. Again, stressing that the lungs help to regulate a little quicker than the kidneys do. However, when the kidneys compensate, it leads to a long-term solution where the lungs we can adjust, pretty quickly through the respiratory system through increasing or decreasing ventilation. So with the protein buffering system, again, this is happening with the blood and it has to do with the hemoglobin. We have CO2 in the tissues and cells, and as they diffuse through the plasma, it gets transported. Eventually it gets dissolved into CO2 and it combines with water and forms carbonic acid. Or it's going to combine with a protein so that hydrogen can be released if we need to get rid of it. Most of the CO2 diffuses in the red blood cells and is going to combine with that carbonic acid though. However, that carbonic acid can disassociate from the hydrogen ion and then we're left with bicarb. Hydrogen ions then combine with hemoglobin and then it's released in the oxygen in the form of HHB. And this buffers the hydrogen ion and makes venous blood a little bit more slightly acidic than our arterial blood. And as our body senses that now we have a higher increase of hydrogen ion concentration, but also now we have elevated CO2, then the levels are going to result in CO2 combined with the HHB. And as that occurs, an increase in the respiratory rate will help to eliminate the excess CO2 and secrete the hydrogen ions through the kidneys, through the urinary tract. In the renal excretion of acid through ammonia, or NH3, we have to remember that ammonia is an important renal buffer. It filters, so through this buffering system, we get the filtering of bicarb. It combines with the secreted hydrogen ion in the presence of Ca, which is carbon anhydrase. This will help to form carbonic acid, which then can disassociate to the water. And if it disassociates to the water, then we're left with H2O and CO2, or carbon dioxide. Both are going to then diffuse into the renal tubular cells. They move into this green section, and the CO2 and the H2O are going to combine to form carbonic acid, and then we have result bicarbonate ion then gets reabsorbed into the blood because it's found another association. So therefore we have titratable acids. The hydrogen ion is then secreted and combines with dibasic phosphate, and it forms monobasic phosphate because we have that extra hydrogen. It gets secreted in the form of the dissociation of the carbonic acid, and then what's left is being reabsorbed into the blood. Ammonia gets formed when NH3 is produced from glutamine in the renal tubular cells, so that's the green cells again, but then it diffuses and where the urine is. So then what's left? We have hydrogen ion. So then it forms ammonium, which is NH3. So again, we're just defining acidity versus alkalosis, or being alkaline or basic. So anywhere between 7.3 to 7.4 is what we're trying to achieve. We get this from an arterial blood gas, usually through the radial artery. And if there's any systemic increase in hydrogen, then we know that there's probably a decrease in bicarb. This causes acidity, or we become in a state of acidemia, anything less than 7.3. But when our pH is greater than 7.3, we can become alkalemia, or in a state of alkalemia, or this is called alkalosis. And this happens when there's a systemic decrease in hydrogen ions and an increase in bicarb. When we have someone that is in some type of maybe vomiting-induced metabolic alkalosis, because they've just been vomiting and vomiting and vomiting, it depletes the extracellular fluid, and then it's also depleting chloride. So we become in a hypochloremic state and a state of metabolic acidosis because we have acid loss. The renal buffering system is not able to compensate. It's not effective enough. And so we have volume depletion of our electrolytes like sodium and potassium, hydrogen and chloride, and then it's going to stimulate a similar response by the kidneys. The kidneys then try to increase the sodium and the bicarb reabsorption with the excretion of hydrogen. That bicarb is reabsorbed and then maintained because the extracellular fluid chlorine concentration has been decreased. This has to do with anion balance. So now we're going to review and put it all together, acidosis versus alkalosis. So there's 4 categories of acid-base balances. We have respiratory acidosis versus alkalosis, or a metabolic acidosis versus alkalosis. So the first thing you're going to do to decide is look at the patient's pH in their arterial blood gas. If it's normal, there's no abnormality. If it's low, we are in a state of acidosis. If the pH is high, we're in a state of alkalemia. Well, now that we know whether we're in acidosis or alkalosis, we need to understand, well, is it respiratory or metabolic? So we'll start with the acidosis. We're in respiratory acidosis if our CO2 is over 44. And if we are in respiratory acidosis, then our body's going to help compensate. The renal system, or renal buffering system, is going to retain bicarbonate and let go of hydrogen because we are acidic. But if we're in alkalosis, then our respiratory system is going to eliminate CO2 and through hyperventilation. And this is shown when we have a bicarb of less than 22. So, same thing is true with alkalosis. If the pH is high, well, is it respiratory or metabolic? Well, it's respiratory if our CO2 is less than 38 because the renal bicarb is eliminating itself, but then now we're retaining hydrogen ions to help compensate for this loss of CO2. We're in metabolic alkalosis if our bicarbonate is over 26 or higher, and our body's going to compensate for that then by retaining CO2. So it puts our body in a state of hypoventilation so that we can buffer the bicarb or the excess bicarb. You might notice a patient might be in metabolic acidosis when you see Kussmaul respirations because which remember again is the rapid respirations, because our body is trying to let go of the excess acid or CO2.